Welcome to our webinar today. I'm here with very special guests, Brenda and Amanda from SleepWell Dental Consulting. Today we're going to talk about integrating sleep care into your dental practice. Amanda, Brenda, thank you so much for joining today. Can you tell me a little bit about SleepWell Dental Consulting and what made you so passionate about this field?
Absolutely. Thanks so much for having us. At SleepWell Dental Consulting, we help offices integrate dental sleep medicine and airway into their practices. And we use processes and systems that are easy to use every day for all of their patients. I think our passion really stems from watching offices be able to help patients live healthier lives. And that's something that both Brenda and I are very passionate about.
That's amazing. And Brenda, I think you had a personal journey into how you got into this field. Can you share that?
Yes, absolutely. So I first discovered the world of sleep medicine about 6 years ago when I went to a training course on sleep medicine. And it was interesting at this training course, they offered to give you a sleep test, and I'd never done a sleep test. And so I took that sleep test, and the next day when I woke up, the sleep test said that I had severe sleep apnea. And I was shocked. So I called a dentist that I knew who treated sleep apnea, and she said, well, you need to get a CPAP. Like, you are 5 times more likely to have a stroke or a heart attack. And I thought, oh, great, a CPAP. Like, that was the last thing that I wanted. But I also wanted to stay healthy. So I thought, okay, I'll do that. And the interesting thing about it is that my background is in dental hygiene. And I had a lot of the signs and symptoms that we teach our teams to look for, but I had no idea what those signs and symptoms were. So I had narrow arch, I had bruxism, I had a tongue tie, and I had a scalloped tongue. So basically, all of those are key signs for sleep apnea. And I had no idea that that was going on for me. So here's the thing is that once I got into treatment for my sleep apnea, I started with the CPAP, but I had myofunctional therapy, I had a tongue tie release, I had oral appliance therapy. And so I had all of the things. And once I went through that process, I just felt so much better. Like, the brain fog that I had lifted. I didn't even realize I had this brain fog, but there was a huge difference. I lost about 15 pounds. I just felt so much more energetic. And this was something that I hadn't even realized was going on for me. So what Amanda and I do is we help the teams to understand what these dental clues, we call them the dental clues, are, so that they can start to see them in their patients. And these patients can have a chance to find out what sleep apnea is all about, because it has a huge impact on our health and well-being.
So not only dentists, we associate obviously with teeth and oral health, but they have such a preview into more health concerns like that. So that's so interesting. You had those symptoms and they were right there in front of you and you just didn't have that correlation piece.
Yeah, no, and it's interesting because I did dental hygiene many, many years ago, and I kind of moved into the consulting field. But over the years, I would hear people say like scallop tongue, and I thought, okay, tongue tie, but I didn't really ever connect the dots to, this is something serious. Sleep apnea is something that can be life-threatening, and it can definitely have an impact on your health. So that's kind of where my passion comes from, is that, kind of having discovered just what a difference it can make to have treatment for that and how much better I feel. That's where I get my passion from.
No kidding. And a symptom as subtle as just brain fog that you just ignore every day, but it's there, and to have that removed must be just day and night difference.
It's a game changer. It really is. Like, because I didn't even, like I say, realize that it was there. But, once I had more clarity and I just felt like that fog had lifted, it made a huge difference.
That's very cool. So in the industry, so dental practices, is this something that every dentist can look into?
Yes, and dentists are in a really unique position to be able to screen and start the conversation. And even if they don't want to treat sleep apnea, being able to screen and refer is really important. It is a service that we're providing for our patients, just like we screen for oral cancer. We should be screening for sleep disordered breathing.
Yeah, I agree. And what a preview. Like, they would have so much insight into your oral health and background, like you mentioned as well. So what you two do is you, from my understanding, you actually go in, you fly to the practices, you travel to them, and they don't really need to move, and you basically teach them what you went through and signs to be proactive.
Yeah,
Yeah.
absolutely. And we take a full team approach. So oftentimes what we see is that the dentist has gone to a course, they've learned all about treating sleep apnea, they come back to the practice, but the team doesn't really understand how to support them. So what that looks like is they'll get a call to the front desk, treat sleep apnea, it's on your website, and the receptionist will give them, maybe an answer like, well, you could come in and have a screening, or I'm not sure, let me check and I'll get back to you. But, it flows throughout the whole practice that way. So what we want to do is make sure that everyone on the team is saying the same thing,
Mhm.
that they know what to say. We have scripting and then, they kind of put it into their own words, but the patient gets the same experience every time and they hear the same thing every time. So there's also systems that we put in place so that once a patient does get screened, and you want to screen every patient, the team knows, okay, what's the next step here? What do we do? And the dentist knows what to say. So it's kind of like a whole scripted flow.
Yeah.
And we want to give that patient the best opportunity to say yes to treatment. So if we don't handle that well throughout the process, the patient can be left with, okay, well, they're not really sure and I might need something. So yeah, it doesn't seem that important. But if the team is on the ball and they're, every step of the way, they're passing that along,
Yeah.
by the time they get to the financial arrangement, they understand what's going on. And then we, also teach the team like how to deal with all the insurance companies, how to, help the patients get, if they do have any benefits, how to access those benefits and how to come up with a financial plan that, works for the patient.
Yeah.
But they have to understand that, there's something that they want to get treated that is having an impact on their health. So that's what we really care about. And that's
Mhm.
kind of our approach for that.
I really respect that approach, like from start to finish, because that is the key piece. And if it's not phrased in a way of, hey, this is actually something really serious, even if it's brain fog or something day to day, to have a dentist, stop for a moment and just say, hey, let's take a look and let's do a deeper dive into this. I mean, that to your point and your story, that can be absolutely life changing. So
Mhm.
that's really important as well. Okay, so from start to finish, you fly to the practices, you basically build them a road to make this, a well integrated program. Where does it start?
Yeah, so we call it the SleepWell path, which is our patient flow. And it's all about patient education and adding value into the treatment. Because if we don't provide value and show the patients why this is so important, then patients typically won't say yes to treatment. And patient education is so important because a lot of people don't know that they have an issue and have sleep disordered breathing. And like we said earlier, dentists are in such a unique position to be able to screen for this. So what we do is we go in, we do a full team training where we really walk through what that flow looks like. Our goal is to build confidence in the team so that they're able to take this flow and make it their own. And it's something that they are going to do with every single patient every single day. So how do we do that without adding extra time to your hygiene share, which is so important, right? So how are we screening in the hygiene share without adding time? How do we book the consults in so that they fit into an already jam-packed schedule? How do we handle the inserts? How do we do these financial conversations so that patients are saying yes to treatment? Simple changes in your verbiage with the financial conversations can mean patients accepting treatment or taking time to think about it.
Yeah.
And the flow is what is really important, and that's what we train on.
And what does it look like once they're trained up? How do you know your job's done?
I think I know when the team is done, when I can sit back and everything works like a well-oiled machine, knowing that the right conversations are having at the right time, knowing that patients are getting into treatment and accepting treatment. And we take just as much pride in watching the teams, their success is our success. So between Brenda and I, we've actually worked with over 100 offices. So knowing that we've come up against just about every roadblock really allows us to be able to help offices work through their individual roadblocks. But two offices come to mind for me. The first one, they identified their roadblock as not being able to get patients to say yes to treatment. So they screen really well, they get patients in for the consults, but they're not able to get them to say yes to treatment. And what we did is we just changed the verbiage slightly in the case presentation and the financial conversations. And after, I think it was 3 weeks working with us and changing the conversations, they had 8 patients accept treatment.
Wow.
Yeah.
That's so fascinating because from a marketing standpoint, we can bring interest, we can do the educational piece, but it can easily fall off if the questions aren't being asked. And to your point, if they're not, proving that it is a serious concern and we should take a moment to look into that. That's really interesting. I could definitely see how vital this is and how beneficial this is for practices.
It truly is a growth area for dentistry today. And dentists who get into it, they find it a really fascinating topic to learn about. So there's a lot of interest that way, but there's interest from patients as well, like their entire practice base can be screened. And we know that 50 to 60% of those patients have some type of sleep and breathing issue. So there's lots of patients there within the practice, but then also with doing some, bringing some marketing in, they can attract patients to the practice, like new patients to the practice that, they're having some issues with their sleep and breathing, and this dentist can help them. So I think that really plays a key in terms of growing the practice, bringing new patients to the practice, and helping more patients. So it's kind of like they already have a base there, but this is something that can really bring a lot of new patients in.
Yeah, and exactly to that point of it is so comforting to know that the solutions are right there at your annual checkup. And dentists are now more equipped, with these technologies and these screenings to be able to identify that for sure.
What we're finding is more and more patients are actively seeking treatment. What kind of marketing can offices look for to help bring those patients that are looking into their practice?
That's an interesting question. There's a lot of marketing tools that can help attract those kind of patients. The first piece is you want to start with what are they going to search when they're at the interest stage and they're just learning and educating themselves. And that could be as simple as why do I have brain fog? And they might think they're looking for, okay, how much coffee do I need? And we want to capture, and so we want to position dentists to make sure that they are educating their patients at that stage. And they may not be ready to seek treatment. They may not even know that there is treatment there. But if we can link them to the websites first from that education piece, that can at least start what we call, the funnel, so to speak. So now we've got a window of people in the educational piece. And then where marketing helps, different tools, this can be social media, this can be blogs, this can be advertisements, is bringing those who have kind of identified, oh, that might be me, I might resonate with that. And how do we bring them into that action phase? And so many different tools. There's probably a lot of people that have guessed or almost self-identified as they have sleep apnea concerns, but it can be one email or one social post that resonates with stats or a story. Stories can be so impactful. Just as you shared, Brenda, with your story, 10 people come to mind that I think, oh, I bet you they have sleep apnea now that I've learned that story. So using social media as well is a really good tool. And I think one myth that I think a lot of practices may overlook is the piece that new can actually be counterproductive. So when you're offering a new service, no one wants to be the first in the door. That can be very scary, especially in an industry that a lot of people have anxiety already about going to the dentist. So instead of stating it as this brand new offering, you actually want to do the reverse. And so what you want is to prove that people are already seeking you out for this, proving that you're already well integrated into being able to identify this. So that is where there's a piece where it's marketing tools. There's actually a really good strategy you have to have behind that. And that is proving that people are already seeking you for this, proving that you are experts in this field.
That makes sense. Yeah.
Yeah.
There is something about like the team, you know, having that enthusiasm and passion for helping patients. And because when we look at like the number of patients that do have sleep apnea, like when we look at stats, the numbers are high, but it doesn't really matter, about stats on a page. When you start to talk to people, even like the team members, and you start talking about these dental clues and the signs and symptoms, they start making that connection for themselves, and they're thinking, oh yeah, my child sleeps with their mouth open. Oh yeah, they've got dark circles under their eyes. These are kind of signs and symptoms. They start to make those connections for themselves, and everybody knows somebody. It's, like you were saying earlier, you were saying, you can think of 10 people.
Yeah.
It's like that for teams too. They just don't realize what it is. And then when they start to make those connections, it's like, oh, I want to help my nephew. And, oh, my husband, like, I'm really concerned. So, it kind of snowballs that way. And the team really gets that passion themselves for it. Like they actually pick up that ball when they start to see, and it starts to become personal for them.
Yeah. And it's funny when, I said 10 people come to mind. So naturally, when we talk about sleep, my mind goes to snoring. But I didn't even go to the point of, children and the proactive side of looking at if they're mouth breathers. So can you tell me a bit about, is there a difference between sleep apnea and just snoring a lot?
Yeah. So they often go together. That is one of the signs and symptoms, and children can snore as well. So dentists don't treat sleep apnea in children. However, there are some things that they can do to help them. Some dentists use appliances to expand the upper jaw, or they'll do myofunctional therapy. Like all of these things can help the child with their sleep and breathing. So there's lots of signs and symptoms in kids, and there is the mouth breathing. They might snore, the dark circles. They might present as having ADD, ADHD. There's difficulty learning at school. There's many signs and symptoms. And again, like once the team learns about that, it's almost like you can't unsee it. Like even if you're in the mall, you can like pick them out.
Yeah.
You can pick up the child that has the dark circles. They're tired. They just have they have a look. And Amanda and I have a favorite slide that we use that Amanda just picked off the internet of a group of kids, all kind of standing together, and like almost every one of them has a sign and symptom of sleep disordered breathing, and that's not what the picture was about. So a lot of children are suffering from that.
So a lot of times adults that have OSA or obstructive sleep apnea start as children with these signs and symptoms. Like Brenda said, in dentistry, we don't treat children with sleep apnea. What we do is we help children before it becomes a problem, a sleep apnea problem. So as parents and as adults, if we can help our kids grow and develop and be the healthiest versions of themselves, be able to focus in school, be able to be, their strongest, healthiest selves. That's the goal. So it's important to be able to screen in kids too and treat those signs and symptoms before they become adults with OSA.
Yeah. And when we were talking about marketing too, Amanda, you had asked me what are the best marketing tools to use. And it's so hard to pinpoint that as an agency. It's not necessarily so much the impact of the tools, but it's the message you're trying to get across. So if you start with a complicated, myofunctional therapy, not everyone's going to resonate with that, and people may not associate as, oh, that fits me. But the second you're talking about symptoms as, a kid just looking a little tired or struggling with their homework, and all of a sudden you just equip people to look out for those signs, that's the most effective marketing, is just storytell and just simplify what the message should be, is how can this impact and better someone's lifestyle. Brenda, could you tell me a little bit about what are some of the challenges that you see when you're trying to integrate this into practices?
Well, that's a great question, because one of the things that I see is that dentists and or their teams might say, well, a lot of our patients don't have that. Like we don't see that in our office. There's not that many patients who have that. So we don't want to invest the time in, helping our patients that way. But the thing that Amanda and I say is that you want to screen every patient, because every patient is like me. Like, I didn't know that I had sleep apnea, and it was having an impact on my health and well-being.
Yeah.
So if we screen every patient just with a simple sleep and breathing questionnaire, or a few questions added into what they're already doing for medical history, that's where we uncover the patients that do have something going on. But it's a matter of like not picking and choosing, and not doing it on a day when you've got lots of time. You want to have a system that is quick, it's easy, we can identify these patients, and then typically in hygiene, we'll get them to connect the dots for our adult patients. Like, we'll say, well, did you know that you've been grinding your teeth? And grinding your teeth is often a sign of the patient trying to open up their airway when they're sleeping. We used to think it was a sign of stress, but now we know that they're grinding to open up their airway. So, or did you realize, that you have a narrow arch? How's your sleep? So, just kind of connecting those signs and symptoms for that individual patient, so that they see it's something that they have. It's not like this thing that's out there, sleep apnea, the big scary thing that nobody wants to have, and you certainly don't want a CPAP.
Yeah.
But so if they're, if it's in the chair and they're kind of, that's what you do as a hygienist. You talk away while they're, opening their mouth. You have like the ideal opportunity to educate, as far as I'm concerned. But anyway, so that's one of the barriers, is that dentists and their teams don't realize how many patients they can be helping. And what are some of the barriers?
I think some of the other barriers come along with the financial conversations and getting patients to invest. And this is an investment that a patient makes. But what we have discovered is that the financial conversation does not have to be overwhelming for the patient. So how do we have a really clear system for that financial conversation? How do we utilize their insurance and their benefits to allow the patient to get the most reimbursement while keeping it easy for the team? The team doesn't want to have several hours of paperwork to have to fill out, but we still want to get patients into treatment. So how do we make that as efficient as possible? And I think that that's probably one of the biggest barriers or roadblocks that I come across, is the financial conversations. The other barrier that offices typically share is their follow-up systems. So what do they do with patients that have screened but haven't gone into treatment? And what kind of follow-up is involved there? So really creating a really strong follow-up so patients don't fall through the cracks.
And that brings me back to the point of, gaining interest and bringing marketing. Effective marketing should be bringing people that are educating themselves and have interest into the action phase. And that is such a core piece of it that can be missed. So to your point, yeah, if you have the whole team behind this, educated, and there's a process, then it's so simple to follow and no one gets missed in that process.
Yeah, and something else I'd like to add too is that some offices struggle with like team turnover, or team
Very much
members
so.
leaving, coming back, like that kind of thing. We typically work with a practice for 12 months. And so we're going in once a month. We're, kind of retraining if someone has forgotten, or if there's a new team member. So what we want to do, our goal is to have those systems solidly in place in the practice, and everyone on the team knowing what to say. And that is not like a one-time training. That's something that you go back and then, we check on, does everyone know what to say? Is this not happening here? Do they need a little bit more help, with the financial arrangement? So it happens over a period of time. So I just wanted to add that.
Yeah, I think that's great. And providing accountability as well.
Yeah.
So the check-ins and making sure that, and if something's not working, then let's pivot. Let's make it work for your office.
Yeah. The marketing brain to me is just spinning with ideas too of what an opportunity as well. If you're integrated into these practices, I can kind of tee you guys up and say, hey, could you just get some testimonials that we could use in our marketing message as well? And that's only going to benefit and get more people talking out loud about this. And again, an effective marketing message is not necessarily as much importance on did they click this button, did they navigate here. It's are these parents now talking about this at their soccer games? Are these educating and developing their own kind of momentum behind that referral system?
Yeah,
Mhm.
word of mouth is great.
Absolutely. Yeah. So, Amanda and Brenda, if a practice was interested in bringing you in, training up the team, maybe they are already integrated into sleep apnea or they're thinking about bringing it into their practice, how do you assess what program's right for each practice?
Yeah, so what we do is we meet one-on-one and figure out exactly what the needs are for each individual office and really customize it to that individual office. ROI is really important to us, and we want to make sure that we're providing value for the dental offices. So what we've tried to do is keep all of our package prices less than one sleep case per month. So we work with a lot of offices that have integrated sleep for a while, and they're always asking us, what is the best advice to help market this?
That is such a good question, and I have so many answers to that. You have to look at your patient base as they're not all in the same life cycle when it comes to educating them about a certain service. So a full marketing program should be well equipped to, again, pass along a important message to people in all phases of their lifestyle. So think about new patients. First, you have to bridge the gap that you offer this and you're actually educated behind it. One huge miss is that practices miss that step on authority. On not only do we offer this, but again, going back to new can be very scary in the dental space. So why would you go? I think about Invisalign too. Just because a dental practice offers that doesn't necessarily mean I trust them with that. So trust is important. So your marketing plan should have messages equipped for that. And then as well, think about your current patients. Do they know the signs and symptoms to look out for in themselves, whether it be for their own lifestyle or as parents or, just other family members? So simplifying the message to your current patients. Once you simplify the message to your current patients, again, you're creating that talk out loud effect. They're more equipped to educate the people. And people, from a psychology standpoint, want to do that. They want to help those that they love. So if they are in a position to educate in a helpful way, they're going to naturally do that. So that can be used, social media can be the tool that helps with that message, but there has to be a strategy behind it. And then as well, okay, great, we've developed interest, we've got people talking out loud about it. How easy is it for them to then take action? And what if they did take action, but their lives got busy and they didn't actually follow through? So is there a system as well from a marketing perspective that revisits that conversation? And finances can be intimidating. It's also a reason that people avoid going to the dentist. And so being proactive in a way and making sure that they know that there is financial options. There is a element of looking into, does your benefits cover this? And being proactive with that conversation can be very, very effective for practices. Okay, great. So if dental practices do need help and need training with sleep apnea, how can they get a hold of you?
Yeah, so basically, all they need to do is go to our website. Our number is on the website. They can contact through a phone call, or there's a place to click and set up a time to chat. And we will take them through a process of doing an evaluation, a mini evaluation on the practice, just to discover some of the areas within the practice that are, where they could grow. So it starts out as a little conversation, and then we, kind of build from there.
Great.
Yeah, yeah. And so, and if they need help with marketing, then how would they contact you?
So for any practices that need support with marketing and are curious or have questions about how to integrate sleep medicine into their dental practice, you can reach any of our amazing team members at our website. And thank you all for joining our webinar today. And a big thank you to Amanda and Brenda for coming in today. Thank you so much.
Thank you.
Thank you.